Hi, I'm Dr. James Stevenson, and I'm one of the gastroenterologists here with the IU School of Medicine. Can you hear and see me okay?
I can.
Great. And before we get started, can you please verify your full name and date of birth?
Sure. My name is Lori Smith, and my date of birth is January 16th, 1976.
Great. And what city and state are you located in?
I am in Indianapolis, Indiana.
Wonderful. And just to confirm, you're in a safe place and location?
I am. I'm by myself in a locked room.
Great. And again, how do I pronounce your first name?
Lori.
Okay. And so, Lori, we're going to be doing this visit via telemedicine. And what telemedicine means is audio and video connection. Do you understand what that means?
I do. During the pandemic, a lot of my work has turned virtual. And so I've done several Zoom sessions and so very familiar with telemedicine.
Great. And are you okay with consenting to today's telemedicine visit?
I am.
Okay. So, Lori, what I'm hearing is that you're having some abdominal pain when you're eating. Can you tell me more about that?
Yeah, I just noticed it probably over the last couple months. I never had it when I was younger. And so for some reason, when I turned 40, I just started having this pain. And it's typically something that when I'm eating, right after I get done eating, I'll notice something and it's kind of up a little bit, kind of under my rib cage. And it's worse if I eat stuff I probably shouldn't eat, stuff like a hamburger or something like that. If I'm doing like a salad or something like that, I don't notice it as much.
Okay. And how would you characterize the pain? What does it feel like to you?
It kind of comes and goes. When it does come, it's kind of sharp, and then it will go away for a while and then come back. It's almost like waves of pain, and then it suddenly, just kind of goes away on its own. Then it does nothing really makes it go away. It's just kind of time.
Have you noticed anything else like maybe nausea, vomiting?
No, sometimes I get a little bit sick to my stomach. I don't want to eat again because then it kind of brings on that pain. So I've been changing my diet and trying some different things to prevent that pain from coming. I haven't vomited. I go to the bathroom normally, and so I haven't noticed any diarrhea or anything like that.
And so you said you changed your diet. In what way have you changed your diet?
I stopped eating things like red meat, some things that I thought were making it worse. And it's still occasionally when I eat things that are like desserty, kind of like that have like a higher fat or something like that, I'll notice it kind of coming back again. And so maybe it wasn't meat related. And so I've been trying to do different foods. It doesn't seem to be as bad if I'm like having like cereal or something like I said, like a salad doesn't seem to bother it so much. But anytime I try to add anything that's a little bit more fun, then it tends to come back on me.
And have you noticed that your weight's been stable over this time? I know you said you've been avoiding food.
Right. Yeah, pretty stable. I usually am a pretty active. I've been less active lately just because I don't like when I do get the pain, I don't really like to move around a whole lot. And so I just didn't know what was triggering it. And so I kind of decreased my activity a little bit. So it's kind of a bummer. I wish we could just kind of want to figure out what it is so I can get back to my normal life.
Any chest pain or shortness of breath?
No.
And as far as your past medical history, do you have any allergies? Are you on any medications currently?
I'm not on any medicines. I don't think I have any allergies to any medications. I don't take things very, very commonly.
And do you have any medical history like high blood pressure, high cholesterol?
No, I am pretty healthy. Some of that stuff is in my family. My mom has high blood pressure, but other than that, I'm pretty healthy.
And any family history that you know of anything like gallbladder disease or any stomach problems like stomach cancer, anything like that?
No cancers. I think my mom did have her gallbladder out. She had a surgery, I think, when she was younger. But I that's all I know.
And I know you mentioned that the pain and where you point to, and we'll get to an exam a little bit later, is more upper. Have you noticed any lower symptoms, any problems with urination, any pelvic pain, change in your menstrual cycles?
No, nothing like that. Seems to be right under the rib cage.
And have you taken anything over the counter for the pain?
I've tried some things like Tums, some of that kind of stuff. I tried like one of the ones for acid, like but I none of that stuff has really helped. The Tums sometimes will settle my stomach a little bit, make me less nauseous, but they haven't really helped make the pain go away.
And when you say you tried one of the ones for acid, do you know what you tried, or is that medication available in your house?
I think it's like a Prilosec, like one of those that you can buy over the counter. They're kind of expensive.
And how long did you try it?
Just for, a week or two, I think. It didn't really do much for me, and so I didn't continue it.
And when your symptoms first started a couple months ago, had anything changed in your diet? Had you been using, or are you currently using anything over the counter like ibuprofen, Motrin, Aleve?
No, not really. No, and my diet has been pretty consistent. I don't think it's changed too much over the last several years, except for the changes that I've made just recently.
Okay. And at the time of the onset of your symptoms a few months ago, there had been no recent illness, or you hadn't gotten any food poisoning or sick.
No, I don't think so. I can't think of anything that might have triggered this. It just kind of started happening. I'm not sure. Seemed like it was related to foods that I was eating. I started to be able to kind of trace it back to bigger meals, like heavier meals, that kind of thing.
And I know you said that you've been feeling sick to your stomach. Is there any possibility that you could be pregnant? Have
No.
you been having normal menstrual cycles?
Yes, I have.
Great. And so, Lori, at this time, if it's okay with you, I'd like to proceed with the physical component of the exam.
Sure.
Sure. And what I'd like to start with is just to have you stand up in front of me and kind of point to the area of where you've noticed the pain.
It's kind of up here. I would say maybe kind of here, but a little bit maybe more on this side. This is my right side, and then it's kind of over on the side a little bit. It's not really over the bones. These are like where my rib cage is. It seems like it's kind of underneath there a little bit.
And does the pain move anywhere, to your back, to your shoulder, down to your pelvis, anything like that?
Yeah, that's interesting. It actually kind of goes. Sometimes I feel like it's like I thought it was more of like a muscle, but sometimes it feels like it kind of maybe goes up toward my shoulder a little bit, or it's like in my back, like my backbone here. It's like somewhere around here. I didn't know what it was, or how it was related.
Okay. And now you say the pain comes and goes. Tell me a little bit more about that pain. When you say it comes and goes, when it comes and goes, does it stay in the same location? How many times a day does it come and go?
Yeah, that's a great question. I think, when I notice it, I kind of, it's severe enough that I kind of just want to lay down. And so I would say that that's happening now maybe 3 times a week or so. And it's usually like after dinner, like after the biggest meal. And I kind of lay on my side, and it feels almost like it kind of comes in waves. So it'll hurt kind of like a sharper pain in that area. Sometimes will kind of shoot up. Like I said, it's odd, kind of like into my back or a little bit into my shoulder. And then that goes away a little bit, and then it kind of comes back. I guess sometimes when I take some deeper breaths, it hurts a little bit more. And then it seems to kind of resolve on its own, maybe in a couple hours or so.
And you haven't noticed any change in the color of your skin or your eyes during this period of time, or over the past 2 months?
No.
Okay, great. And so I'll have you to stand back up for me.
Sure.
And you've already kind of showed me the area on your right upper side. Can you push on your belly button and tell me, do you ever get pain in that region?
No,
Okay. Now I want you to go to your right lower abdomen and push on that area. Do you ever get pain down there?
I don't. No.
Okay. Now let's go to the left upper side,
Okay.
and I want you to push there. Do you ever get pain there?
No.
Okay. And do the same thing in the left lower side. Do you ever get pain there?
No.
Great. And so, Lori, what I'd like to do, if it's possible, to get a more thorough exam, is to ask you, do you have a thermometer or blood pressure and or blood pressure cuff available?
Yeah, they actually asked me to take some of those readings before the visit, so I would have them ready for you. And so my temperature was normal, 98.8 is what it said. And I took my blood pressure and it was 126/82.
Great. And did they ask you to take your pulse as well?
They didn't, but I can do that. I think I can find it here on my wrist.
Okay. And so what I would want you to do, we're going to pause for 15 seconds and I'll be having a countdown for the next 15 seconds. And I want you to tell me how many beats you feel over those 15 seconds from
Okay.
your pulse.
Perfect.
Okay. Great. Great. And so, Lori, how many beats did you notice?
I noticed 10.
Okay. Okay. 10 over the course of the 15 seconds.
Yes.
That's a little bit low of a pulse, and I may have been too quick in my countdown. So what I'd like to do is to just try to repeat that.
Okay.
Because a pulse of 40, unless you're just really super healthy, and is a little on the lower side. So let's just repeat that again, okay?
All right.
And I'll make sure I'm doing my 15-second countdown.
Okay, let me make sure that I can feel it first. Maybe it took me a little time.
And you use your index and your index and your middle finger,
Okay.
and you put it just in that little groove, and
Okay.
you want to just feel like there's almost like a rebound
I got it.
kind of in
Yeah.
it. You feel that? Okay.
Yeah. Sorry.
Okay. Yeah. And so let's do our countdown. You feel it?
Yes.
Okay. I'll start now.
Okay.
Okay. Now, what number did you get?
Okay, that was 20. Yes.
Okay, okay. That makes me
That was my fault.
No, that makes me a lot happier. So a
Good.
pulse of 80 is normal, and it was not your fault. I did not give you great explanation on where you should be palpating. So
I appreciate
it was
it.
definitely my fault. So now what I typically ask, and it's okay if you don't have a family member or someone available to help with the abdominal exam while you're lying flat on your back, but is there someone available that you'd be comfortable with helping you with doing the abdominal exam at home?
I don't think I have anybody available right now.
Okay, no problem. So, Lori, what I want to do is to have you to lie on your back, because that sometimes can give me some information as far as the intensity and the severity of your pain.
Sure. You want me to move my camera so it's down a little bit?
Yes,
Okay.
and I want to just so I can be able to actually see you there on the couch.
Okay, perfect. Let me see if this will work.
Awesome.
Okay.
Perfect.
Perfect.
And I want to start on the left side.
Okay.
And I want you to take both hands kind of on top of each other.
Okay.
And I want you to, yes, to press softly on that area. And tell me what you're feeling.
Okay. When I go down on the left side, I don't feel anything. It feels very normal and very soft.
And so I want you to get progressively deeper with feeling it on that left area.
Okay.
And go deeper and tell me if you feel anything different than when you were soft.
Nope. Feels very
Okay.
normal.
Great. Now let's move down to your left lower abdomen. And I want you to do the same thing. Start off very light and tell me if you're feeling any abnormal or any sensations of discomfort, gasiness, bloating, anything like that.
Okay. Nope. Feels very normal.
Okay. And go a bit deeper for me like we did before.
Okay. Yep. Feels normal.
Great. So let's move over to your belly button.
Okay.
And go right over the belly button and do the same thing. Start off softly.
Perfect. Yep. Feels
And
okay.
And then go deeper for me.
Okay. Yep. That feels normal.
Okay. Now let's move to your right lower abdomen and do the same thing again. softly.
Okay.
Any abnormal sensation, gas, bloating, discomfort, pain?
Okay. No, that feels normal.
Great. And so, Lori, let's finish in the area where you've been describing the majority of your pain in your upper and in your mid abdomen.
Okay.
Kind of tell me what you're feeling as you're palpating there in the upper abdomen.
Okay. So that's where I've noticed, yeah. Yeah, definitely when it's lightly, I don't notice it as much, like I don't really feel any pain there. But when I'm pushing deeper, kind of makes you take a deep breath in. Like it's hard to push deeper in that area.
Okay.
It actually,
And with
yeah, it hurts. Yes.
Okay. And if you just kind of quickly push deeply and then let go, what happens?
That's okay. It hurts about the same. It's uncomfortable, but it's not worse.
Great. Thank you so much, Lori, for doing that exam for me. The final part of the exam I'd like you to do, just to make sure that we don't need to do anything emergently, is I'd like you to stand up for me.
Okay.
And I know this is a bit weird, but we're checking for any severe irritation in your peritoneal cavity. Can you jump up 3 times for me?
Yep.
Great.
That's fine.
Okay. Okay. Awesome. Well, I think I have an idea of what may be going on.
Oh, wonderful.
So I wanted to kind of sit and talk through some ideas.
Okay.
And there are 2 main things that I'm thinking about based on what you're telling me, particularly with you changing your diet and noticing that the symptoms come after a meal, and the symptoms seem to kind of come and go in waves. So, and the fact that you had a mother with gallbladder issues. So what we know is that gallbladder issues can sometimes run in families.
Okay.
So one thing that I may be thinking about is something called biliary colic. And biliary colic is where you can have gallbladder dysfunction. And it could be related to the gallbladder just being really inflamed and kind of chronically feeling icky, or to stones, gallstones. And both could cause symptoms that are, worse with certain types of meals, particularly fatty meals. So that's one thing I'm thinking about.
Okay.
And then the second thing I would be thinking about is something called dyspepsia.
Oh.
And that's where you can get just gut upset. Sometimes dyspepsia can lead to inflammation in the stomach called gastritis.
Okay.
And even potentially stomach ulcers.
Oh, okay.
Or small intestine ulcers, what we call peptic ulcer disease, where you can also get ulcers not only in your stomach, but your small intestine.
Okay.
The reason why I'm not thinking that you're having ulcers is because oftentimes ulcer pain is improved with medicines like the Prilosec.
Oh, okay. Yeah, I did try that for a couple weeks. Okay.
You tried that for a couple weeks. Yeah. And you haven't used any medicines that can commonly cause ulcers based on what you're telling me, like ibuprofen, Motrin, or Aleve.
No.
And so to help us get more information, a lot of times I would start with 2 things.
Okay.
And I want to get your input on this. I'd like to potentially place you on a prescription strength medicine similar to the Prilosec, because sometimes it's just a matter of putting you on a higher dose of that medicine.
Okay.
But before we do that, checking a stool study to screen for a bacteria in the stomach, or a breath test, whichever you prefer, to screen for something called H. pylori, which is a very common stomach infection. I've even had the infection a few years ago, and it's easily treated with the course of antibiotics typically.
Oh, wow. That would be great.
So that's one thing I'm thinking about.
Okay.
But also starting with an ultrasound of your gallbladder to tell us more about, do you have gallstones? Does the gallbladder appear thickened? Just to kind of give us as much information so that we can help you to get improvement in your symptoms and get a cause for what's going on.
Okay. No, I really like this idea. I, have, of course, Googled everything and before the visit, and I was really worried I was going to have surgery. And so this would be great if I, get the ultrasound, we'll see what we see. But if it could be something that was easily treated with a medicine, that would be great. And so I really like both those things. And so that way we can hopefully do this without having to have a surgery. So I appreciate that.
Great. And so what I will typically do then is I'm going to first order the ultrasound
Okay.
Do you have a preferred location where you'd like to get the ultrasound within the Indianapolis area?
I can just go to the hospital, the IU hospital. That's fine.
Okay. And when you say the IU hospital, I know you said you're located in Indianapolis. Do you mean Methodist or University Hospital?
Either one.
Okay.
Yep.
Okay. So I'll order the ultrasound to Methodist.
Okay.
The other thing, Lori, is the stool or the breath test. Which one do you prefer? Most people honestly would tell me they prefer just to do the breath test, but the stool test, they're both very, very easy. They both are very, very good at detecting that bacteria.
Yes, the breath test is perfect. I was hoping
Okay.
to have the option. Yes.
And so for that breath test, you typically just when you go to the lab, and you don't necessarily need to be fasting for more than an hour, nothing
Okay.
to eat or drink before an hour before that breath test.
Okay.
And then the final thing is I will order the prescription strength antibiotic the prescription strength proton pump inhibitor
Okay.
that I'd like you to take 30 to 60 minutes prior to breakfast.
Okay.
To your pharmacy, but I don't want you to start that until you complete the breath test because it can interfere with the results of the breath test.
Okay.
So I'm going to order it to the pharmacy, but the
Okay.
very first thing that I want you to start with is to get the breath test. The ultrasound we typically can get scheduled, this week. And so you can just go to the lab the same day that you go for your ultrasound because you'll need to be fasting for the ultrasound anyway, if that's, what you prefer.
Wonderful. That sounds perfect. Thank you so much.
Right. And does this plan of care sound okay with you?
It does. Should I do anything different with my diet? Should I just continue to stop eating? Just try to maybe figure out what's bothering me and then stop eating those things, or what do you think?
Great question. I typically, when patients are complaining of possible gallbladder related pain, we do know that fatty meals can contribute to symptoms. And when you're having dyspepsia, foods that are spicy or foods that are acidic in nature can worsen dyspepsia. So things like tomatoes, onions, garlic, and things that are high in fat. So I'm thinking of things like beef,
Gotcha.
the chicken thighs as opposed to chicken breast. And so those would be the main things that I would be looking out for. French fries, any fried foods, I would just kind of limit those until we get more information.
Perfect. That's kind of what I was doing anyway. So I will definitely continue to do that.
Great. But this is what I want you to do for me, if possible, Lori. If anything changes in your symptoms, like your symptoms, you're starting to have more severe symptoms, any fevers, nausea, vomiting, any change in any of those, I want you to contact my office. Or if your symptoms are worrisome to you, and when I say worrisome, fevers, severe bouts of pain that are, more severe than what you've been experiencing when you're having to lie on the couch and take a break, I would just go to the emergency room because, sometimes if you pass a gallstone, it can get lodged in your in the bile duct and cause kind of severe pain, or even worse than that, something called pancreatitis. And so we don't want to kind of sit on that. So if anything severe happens, like I was saying with the fevers, worsening pain, or any other concerning features like severe nausea and vomiting, I'd like you just to go straight to the ER as opposed to contacting me.
Okay, perfect. I understand that.
Great. And so just to kind of summarize, I always like for the patient or for my patients to make sure that that I've explained everything clearly. I want you to tell me what I've just told you about what we're going to, our plan of care.
Perfect. Yes, I think I can do that. So, from what I understand, it's either something with the stomach or potentially there could be something with the gallbladder. And so, we're going to look at both things. And the gallbladder requires the ultrasound, which you'll order for me around where I live. And then the stomach, though, we're going to do a test, not the stool test, we're going to do the breath test to look for something in the stomach, like a bacteria or bug or something that's could be causing symptoms that we could treat. And then I'm also going to do a medicine, but I don't want to do the medicine, the high dose, the Prilosec, the higher dose, until after I do the test, so it doesn't mess up the test. And then as far as my diet, I kind of just do the same things as far as making sure that I'm avoiding things that are a little bit heavier or fatty. But if things start to get worse, where the pain gets really bad, or I start to have fevers, or I can't keep anything down, then I would want to, go into the ER, or especially if I started, feeling really, really sick. Is that right?
Perfect.
Okay.
Yes. Thank you for explaining that back to me. It makes me feel comfortable that that we're on the same page. Do you have any final questions? Oh, I think the one thing is I just want to make sure that we will send the prescription through to your pharmacy of choice.
Okay.
Which pharmacy do you prefer, Lori?
CVS.
And do you have a particular CVS near you that I can send this through to?
I think the one on Michigan is perfect.
Okay, so I'll send that through. You should be hearing from radiology within the next 3 to 4 days.
Okay.
The lab has already been ordered and you can get that at your convenience. If you don't hear back from radiology, I want you to contact my office.
Okay. Okay. I have your number.
Great. And are you on the portal?
Yes.
Okay, so a visit summary of everything that we've done should be available to you on the portal within an hour, everything we've
wonderful.
discussed. And so you can review it there. And if you have any questions, you contact us on that number.
Oh, that's perfect. Thank you.
Thank you. Thanks for your time, Lori.
Absolutely. Thanks so much.
Bye-bye.
Bye-bye.